My name is Kristen Elizabeth Rodriguez. This presentation is for Aspen University on August 31st, 2020. The class is pharmacology and the instructor is Professor McMillan. The scenario we were presented with was the emergency medical services team has brought a 54-year-old female patient to the emergency department where you are working. The EMS personnel state that the patient was found wandering in a nearby park by a jogger who called 911 from her cell phone after the woman screamed obscenities at her and then fell, seriously scraping her arm and face. The woman is bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. Her hands were shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and you can smell stale body odor and urine. Based on your first impressions of this patient's actions and appearance, what do you suspect she is suffering from? The patient in the scenario appears to have signs and symptoms that align with someone who has schizophrenia. Some of the signs and symptoms of schizophrenia can include things like disorientation, hallucinations, not being able to organize thoughts properly, having disorganized speech, being anxious and stressed, acting inappropriately like childish behavior, and not being able to respond with emotional appropriateness. Another potential cause of the patient's behavior could be related to dissociative identity disorder, otherwise known as multiple personality disorder. Dissociative identity disorders often include memory loss, emotional detachment, wandering, and not knowing personal identifiers. What short and long-term health risks would you suspect this patient faces? The first condition that crossed my mind when assessing this patient's symptoms was schizophrenia. So let's go ahead and focus on that. If the patient has schizophrenia, the short-term health risks include hallucinations, delusions, not being able to speak clearly, atypical behavior like silliness, and not being able to function at a normal level. Long-term effects of schizophrenia can include suicidal thoughts and actions, long-term depression and anxiety, social separation, abusing substances, financial issues and homelessness, health problems, and inability to sustain a job. Why do you think the patient's hands are shaking? And what do you think causes her confusion and combativeness? The patient could have these symptoms for a number of reasons. One plausible reason could be that the patient is having a reaction to a medication or they are potentially taking the wrong dose, either too much or not enough. Another possible reason for the hands shaking could be caused by tremors that are associated with schizophrenia. Other causes for this behavior could be related to another schizophrenic symptom like atypical motor function. People who suffer from schizophrenia sometimes have unpredictable and oftentimes inappropriate social behavior. The behavior can range from agitation to not following instructions or not responding at all. What assessments do you think are needed for this patient? For this patient, I would suggest they get a mental health assessment. A mental health assessment would help to recognize the symptoms that the patient is experiencing. It would also help to establish a mental health treatment plan. Some tools that the doctor and counselors may utilize during this assessment are observations, interviews with the patient as well as the patient's loved ones, and other tests that may help the medical team determine the most appropriate treatment plan for the patient. Hopefully, this would lead to an official diagnosis, assuming they don't already have an established diagnosis. This could provide them with tools like counselors or adjustments to current or new prescription medications so that the patient can start feeling more in control of their own life. The goal of this treatment is for the patient to see an improvement in their mental health. This is the research question. Mental health management includes both pharmacological and therapeutic methods for treatment. Summarize how this is managed and the support of insurance. Is it sufficient? What could make it better? Mental illnesses typically fall into three types, and they are anxiety, affective, and psychotic disorders. Anxiety is usually categorized as the patient feeling like they have a sense of dread or they are afraid. Anxiety is sometimes a result of another condition that the patient has, like thyroid disease or hypoglycemia. Pharmacologic treatments for anxiety disorders include anxiolytic drugs that are found in benzodiazepine drug class, as well as the drug buspirone. Affective disorders are often referred to as mood disorders, and they can include conditions like bipolar disorders as well as depression. Pharmacologic treatments for affective disorders include mood stabilizing drugs and antidepressant drugs. Psychosis is a mental disorder that affects the patient so severely that they may not be able to function in normal life. Disorders that are included in this category range from schizophrenia to autism. The pharmacological treatment for psychosis is antipsychotic drugs. Therapeutic treatments work especially well for mental health patients in congruence with pharmacological treatments. Some examples of therapies that are effective for those with mental health issues include CBT, which is cognitive behavioral therapy, exposure therapy for people, especially with anxiety disorders, relaxation therapy, mindfulness, music therapy, and other things as well. Since the year 2008, medical insurance companies are required to cover mental health services. This is thanks to a law known as the Paul Wellstone and Pete Demensy Mental Health Parity and Addiction Equity Act. The new law made it a requirement for insurance companies to treat mental illnesses in the same way that they treated other non-mental related conditions. Some plans are not required to follow the law. One example is Medicare. Medicare is exempt from the equality law. This law does not mean that insurers have to offer mental health benefits. It does mean that if the insurance company chooses to provide mental health services, they cannot have different requirements than they do for non-mental illness related conditions. This law also does not apply to the cost of copays and or deductibles, and that is subject to the details laid out in that specific plan. I do not believe that insurance companies have enough responsibility or liability when it comes to covering mental illnesses. Many people suffer from mental illnesses, and they should be treated in the same way that any other disease or condition would be treated. I still think that there's a stigma attached to mental illnesses, and it just doesn't belong anymore. I would like to see insurance companies covering more mental illness related conditions in the future. Thank you very much.